Welcome back to our channel, where we bring you the most recent and authentic studies on psychology, mental health, and relationships. Before we start, please hit the like button and subscribe to stay updated about our latest videos. Today's topic is mental health in old age, signs of depression and anxiety. Our older loved ones are prone to mental health issues just like anyone else, but there are some conditions which can affect them more than others. And while it can be difficult to spot depression and anxiety in younger people, it can be even harder when you're dealing with someone who's getting older. Depression and anxiety are common in old age, but many seniors suffer in silence. This can be due to several factors, such as the stigma surrounding mental health, fear of being a burden to family members, or simply not knowing how to seek help. But these problems don't just go away if ignored. They can worsen over time and lead to other physical health issues. Depression and anxiety can manifest themselves in different ways in older adults. While the common signs include social withdrawal and changes in sleep patterns, there are also less obvious signs that may indicate your loved one is struggling mentally. Here are 7 less obvious signs of depression and anxiety in the elderly. Number 1, agitation and restlessness. It's normal for seniors to slow down and take things at a slower pace, but agitation and restlessness could mean something else entirely. If your loved one seems constantly agitated or restless, they might be experiencing a mental health issue. This sign isn't limited to those suffering from dementia, although it can be a symptom of that condition. Agitation and restlessness can also occur in people who are anxious or depressed. People who suffer from anxiety often find themselves unable to relax or stay still. They may pace constantly or fidget with their hands and clothes. On the other hand, agitation can be a sign of depression. A person who is depressed might have trouble controlling their emotions and may lash out or become easily irritated. Number 2, changes in appetite or weight. Appetite changes are common in older adults, but seniors who suffer from depression or anxiety may experience more dramatic changes. Depression can cause a loss of appetite, which can lead to weight loss and malnutrition. In contrast, anxiety can increase appetite, leading to weight gain. Seniors who suffer from anxiety may use food to self-soothe, which can result in overeating. It is important to note that these are just potential signs, and not every senior who experiences changes in appetite or weight is necessarily suffering from a mental health issue. However, if you notice that your loved one is eating significantly more or less than usual, it's worth talking to them about it. Number 3, crying easily. Crying can be a natural response to a wide range of emotions, from sadness to frustration to pain. However, if your loved one has been crying more than usual, and it seems like nothing is making them feel better, this could be a sign of depression. Crying spells can also be a sign of anxiety or stress. Some older adults might cry because they're overwhelmed by the changes in their lives, whether it's the loss of a loved one, the onset of a chronic illness, or simply the challenges of getting older. Whatever the reason, it is important to you to talk to your loved one if they crying frequently, and try to get them the help they need. Number 4, poor sleep quality. Sleep disturbances are common in older adults and can be caused by a variety of factors, including physical illness, pain, and medications. However, poor sleep quality can also be a sign of depression and anxiety. People who suffer from depression often have trouble falling asleep or staying asleep. They may wake up frequently throughout the night for no apparent reason. Anxiety, on the other hand, can make it difficult to fall asleep. People who suffer from anxiety often spend a lot of time worrying about the future or dwelling on past mistakes. This constant state of alertness makes it hard to relax and fall asleep. As people get older, they often become more socially withdrawn. Number 5, social withdrawal. This can be due to a number of factors, including physical limitations, cognitive decline, and the loss of friends and family members. However, Social withdrawal can also be a sign of depression and anxiety. When someone is depressed, they often isolate themselves from others. They may withdraw from social events and stop returning phone calls or emails. Similarly, people who suffer from anxiety tend to avoid social situations. They may feel uncomfortable around large groups of people or feel like they're being judged or criticized. This can lead to social withdrawal and isolation. Number 6. Loss of energy. A lack of energy is a common symptom of depression. Depression is a mental illness that causes a person to feel sad, empty, and hopeless. It can also cause physical symptoms, such as fatigue. Fatigue is a feeling of tiredness or exhaustion. It can be caused by a number of factors, including lack of sleep, physical illness, and emotional distress. In people who are depressed, fatigue can be both a cause and a symptom of depression. The lack of energy can make it difficult to carry out daily tasks. It can also make it difficult to get out of bed in the morning and get started on the day. This can lead to a cycle of inactivity and depression. A lack of energy can also be a sign of anxiety. People who suffer from anxiety often worry a lot. Worrying uses up a lot of mental and emotional energy, which can lead to fatigue. Additionally, anxiety can cause physical symptoms such as muscle tension and restlessness, which can also contribute to a lack of energy. Number 7. Frequent illness. There's a link between mental health and physical health. This means that problems in one area can affect the other. For example, people who have depression or anxiety are more likely to have physical health problems, and people who have physical health problems are more likely to develop mental health problems. One way that this link manifests itself is through frequent illness. Studies show that people who have depression or anxiety are more likely to catch colds and other infections. There are a few possible explanations for this. First, people who are depressed or anxious may not take care of themselves as well. They may not eat healthy foods or exercise regularly, which can weaken the immune system. Second, depression and anxiety can weaken the immune system directly. And third, people who are depressed or anxious may be more likely to engage in unhealthy behaviors, such as smoking or drinking, which can also weaken the immune system. If you notice any of these signs in yourself or a loved one, it's important to seek professional help. These signs could indicate a serious mental health issue that needs to be addressed. Therapy can help people develop coping mechanisms for dealing with depression and anxiety. With treatment, however, many of these issues can be managed successfully. Treatment options include therapy, medication, and lifestyle changes. Medication can help alleviate symptoms, while lifestyle changes, such as regular exercise and a healthy diet, can improve overall mental and physical health. It is also important to remember that just because someone is old doesn't mean they are not capable of having a mental illness. In fact, mental illness can affect people of all ages. However, there are some mental illnesses that are more common in older adults, such as dementia, Alzheimer's disease, and Parkinson's disease. Dementia is a general term for a decline in mental ability that is severe enough to interfere with daily life. Alzheimer's disease is the most common type of dementia. It's a progressive disease that gets worse over time. Parkinson's disease is a disease that affects movement. It can cause tremors, stiffness, and balance problems. We encourage you to reach out to a mental health professional for help. While these diseases are not technically mental illnesses, they can cause significant mental and emotional distress. We hope this video was helpful in providing you with some insight into the warning signs of depression and anxiety in older adults. If you think you or a loved one may be at risk, please share your story in the comments below. Remember, seeking help is a sign of strength and the first step towards recovery. We'd love to hear your thoughts on this topic. Don't forget to like and subscribe for more helpful content. Take care. Have you or a loved one experienced depression or anxiety? What did you do to cope? Your experiences can help others who are going through similar situations. Thanks for watching.